Okay, so for today's lesson, we will be discussing diet therapy plus regular hospital diets. Okay, so first and foremost, how we define diet therapy. Let's start with the word diet itself. Okay, so diet is an allowance of food and drink consumed regularly by an individual. So basically, what we eat and drink every day. Okay, so diet therapy, or another word for this is dietotherapy. This is a branch of dietetics that is concerned with the study of the use of food for therapeutic purposes. This is also the, okay. This is also the study of the modification of the normal diet to meet the physiologic requirements of the sick individual. Okay, and another definition of this one is this is the study of the use of food as a factor in aiding recovery from illness. And that is why we will be discussing the different hospital diets as well. Okay, so next we also have therapeutic diet. Okay, so this is a diet modified or adapted from the normal diet to suit specific disease conditions. And another definition of this is it's a diet designed to treat or cure disease. Okay, so just a basic definition of terms for the first few slides. Okay. Next, we have routine hospital diets. So these refer to the regular, soft, liquid diets commonly used in the hospital that differ from one another in consistency and composition to suit individual needs and dietary requirements. So I'm going to give a basic example. So let's say yung galing surgery like CS, yung cesarean section kay gikan tag DR sa section 2E. Okay? So basically before a surgery, the client is ordered to be on NPO or non-per-orem. Why? Because that is to prevent aspiration since bibigyan ng anesthesia ang patient. Okay, so magiging unconscious siya for the duration of the procedure. Okay, so once the procedure is done and the patient will be wheeled into the recovery room, NPO pa rin siya. Why? Because the patient is still dealing with the effects of anesthesia. Okay? So, so the next diet that will follow, okay, pag medyo awake na siya, okay, so the patient will be ordered to be on general liquids. Okay, so hindi siya pwede full diet agad. Why? Because the body is still adjusting, okay, again from the effects of anesthesia, and it may be detrimental to the GI tract of the patient if bigla siya mag-take in ng regular food agad. Okay, so that would hamper the healing or recovery process coming from surgery. Okay. Okay, so following the general liquid diet, let's say nakautot na si patient. Okay, so if the patient was able to pass out gas, okay, that would tell the surgeon and the anesthesiologist na the patient's body is going back to the normal functioning. Okay, especially yung pagbalik ng peristaltic movement. So when the patient has already passed gas around 3 times, then that will tell the doctor na pwede na sila mag soft diet. So soft diet. Okay, so pwede lang yung mga papaya, fruits, okay, mga other fruits, okay, gulay. Okay, again, para hindi good mabigla yung body, okay, um with the progress of food. Okay, and then later on, pag naka-pass out ng poops ang patient or if naka-defecate na siya, then that's the time na pwede na siya mag full diet. Okay, full diet or diet as tolerated. Okay, so ganun yung sequence. Okay, we call that progressive diet in the hospital setting. Okay. Okay, so next we proceed to the purposes of diet therapy. Okay, so it is to maintain or restore good nutritional status. It is also to correct nutritional deficiencies which may have occurred. Okay, so to afford rest to a particular organ or to the whole body which may be affected, to adjust the diet to the ability of the body to metabolize the nutrients, and to bring about the changes in the body weight whenever necessary. Okay, so let's say, for example, you are dealing with a patient with severe malnutrition. Okay, so, or who is experiencing mga electrolyte deficiencies. Okay, so you would expect that the diet for that patient would include foods that are high in calories, those foods that are high in those electrolytes that the patient needs, especially in potassium, the iron, the fats, so on and so forth. Okay, so next part, let's go to the basis for modification. Okay, so for the normal requirement, we have the RENI or the dietary prescription. Okay. By the way, guys, there's this setting with my Zoom account na I have to admit people manually. Dati kasi, um, naka-disable yung waiting room. That's why every now and then I have to admit students manually. Okay, I don't know why, but I think, but ever since I subscribe to Zoom on my own, hindi ko ma-disable yung waiting room. Okay? Okay, so to continue, for the dietary prescription, we have the guide to good nutrition or the food guide. You may also use the food pyramid or the Pinggang Pinoy, okay, in selecting the types of food and the the quantities of the food items that you may want to give to your patient. Okay, so previous nutritional status of the individual. Okay, so that also has a bearing on the type of diet that will be prescribed to the patient. Third, pathophysiology of the disease. Okay, so itong si pathophysiology of disease, like one example, yung kidney disease or renal disease, hindi sila pwede sa excessive sodium, hindi din sila pwede sa excessive protein. So, they have restrictions for protein and sodium. Okay? Kasi nakaka-damage ng kidney. Okay? Um, another example, okay? So, cardiovascular disease or your CVD, especially for patients who have plaque formation. Okay? So, may sobra silang fat deposits in between their blood vessels. Okay, so they would always you would expect that they will have fatty food restriction. Okay, so mga ganon na example. Okay. Next, you also have the anticipated duration of the disease and injury. So, sino dito naka-experience na um, mag dental visit like mabunutan ng ngipin, 'di ba? Right, or kanang um, mag-undergo ng braces, okay, magpalagay ng braces. 'Di ba soft diet kayo initially, okay, until sa ma-tolerate na ninyo yung braces, okay? So those are some indications for the modification of one's diet, okay? So you will learn more about that as we go on. Okay? So next, dietary factors to be altered. Okay, that's another basis for your modification. Next, you also have the amount and character of the nutrient which is being lost from the body. Okay. Next, we have the patient's tolerance for food. wait lang, lax, apostrophe. Okay, patient's tolerance for food. Okay, so another example, let's say you have a patient who is lactose intolerant. Okay, so definitely you are going to avoid giving that patient any dairy food products. Okay, para hindi ma-trigger yung kanyang lactose intolerance. Okay? So next we have socio-economic and other considerations such as religious beliefs, customs, etc. So this is why, upon receiving your patient or upon admitting your patient, it is important to take note of his or her religious affiliation because um, some religions may have dietary restrictions. Yeah, let's say for example, sa Islam, 'di ba bawal ang pork? Okay, so that's that's one example. Um, in other religions such as yung ating mga Indian, yung mga Indians or yung mga those who are practicing Hinduism, 'di ba sacred sa kanila yung cow. Okay, so bawal sa kanila yung beef and some other meats. Okay, so mga ganon na considerations. Okay, so aside from those dietary restrictions, they may also have some specific dietary practices. Okay, so one example, okay, that I just learned from my uh, that I learned from during my NCLEX review. Okay, we have this kosher diet. Okay, so itong si kosher diet, it is practiced by the Jewish people, especially those in the Orthodox religion. Okay, so meron silang mga particular food preparation practices. Like, they can only use their own utensils, tapos sila lang pwede mag-unwrap sa utensils nila. They also have specific food restrictions. Like, there are some meats that are allowed and there are some that are not allowed. Okay, so medyo maputi siya. I'm just going to post no kanang infographic on that one. But it's quite interesting kasi um there were some instances kasi during my practice exams na like it goes this way kanang you are dealing with a Jewish patient observing the kosher diet, which food items and practices are applicable to that patient. So magpili ka sa mga choices kung ano yung swak sa kosher diet. Okay, so mga ganon. Okay, so kahit sa NCLEX review, nagpapakita si nutrition. Okay, so um, for you guys, no? For you guys, for NLE and NCLEX, we are more on kanang food selection, food preparation, and health teaching sa food. Okay? If ever may mga computations, the only computations that you will have to worry about will be yung BMI and yung 449 na rule. Okay? So, chillax lang for the nutrition aspect. It's only here in SPC na that you had to experience yung pinabonggang computation. Okay, but when you reach or when you go into the clinical setting, all those computations will be care of the dietitian. Okay, so much for that one. Okay, so next we have principles of dietary management. Okay, so number one, we have liberalization. Okay, so I'm just going to let you guys see this part. Okay, kasi wala ito sa um, Quaper. Okay, so itong si liberalization, liberalized diet approach means relaxing the therapeutic diet prescriptions intended to control disease states like diabetes or hypertension. Okay, meaning from a very restrictive and selective diet to an as tolerated diet. So the goal is to promote quality of life and enjoyment of foods not previously permitted. Okay, so dati, okay, so for diabetics and hypertensive patients, grabe yung pagbabawal sa kanila with regards to sweet or sugary foods for diabetics and for anti-hypertensive for hypertensive patients, talagang bawal sila sa mga fatty and salty foods. But because of this liberalization mood, some physicians still allow them to enjoy those to enjoy some food items previously restricted to them. Okay, so hanggang sa matolerate nila. Okay, so good, small or moderate amounts will do. Okay, para maka-enjoy pa rin sila sa pag-intake ng food. Okay? Next, we have individualization. Okay, individualized diets are usually based on the anatomy and physiology of the disease. Okay, so this is very restrictive and selective, like CKD or chronic kidney disease and phenylketonuria. Okay, or PKU. Third, we have simplification. Okay, so simplification of the diet focuses on time, energy, and the availability of resources. Okay, so ito siya, yung pinaka-best example that I can give you, okay, back from my NLE days, there was one question that when you are dealing with a family who needs you're dealing with a family, if you're dealing with an impoverished family who needs to increase their protein intake, which of the following food items will you suggest? Okay, so out of the four choices, yung ma-remember ko is my fish, tapos my kamote. Okay, so between the two, considering that impoverished yung family, um, the correct choice daw back then was kamote. Okay, so may mga ganun na trick questions, okay, in the NLE kasi you have to consider yung financial state ng family. Okay, so ng family, okay, when it comes to selecting food items. Okay, so yung pinaka-point dito is yung availability of resources, yung energy, yung time sa pag-prepare. Okay, so that is what you call your simplification. Okay, so this ends the first slide. So 12 short slides lang po ito. Okay, so I already posted this one on paper. Okay, so the next, okay. Okay, so the next lesson will be on the different types of routine hospital diet. Now, for this lesson, it's 28 slides, 28 minus 1 for 28 minus 2 for the title. Okay, so ano lang siya, 26 slides. Okay, so most likely by 9:30 matapos ko na itong lesson for both 2E and 2G. Okay, so for the routine hospital diet, we have modification in texture and consistency. So ito yung dimension ko. We have clear liquid progressing to general liquids, soft diet, full diet, diet as tolerated. We also have hospital diets based on composition. So we have the low residue or your low fiber diet. We have low salt, low fat diet. Okay, so this is for hypertensive, for those who are hypertensive, for those patients who are hypertensive. Okay, so sa endorsement pa lang, no, the very moment that you hear the type of diet that is ordered for your patient, it will give you already a good picture of what your patient's case may be. Okay, Next, we also have diabetic diet, obviously for diabetics. And we have the renal diet for patients with CKD. Okay, so chronic kidney disease. So bawal sila sa mga sodium, bawal sila sa increased intake of sodium as well as proteins. Okay, so you really have to be particular sa food items that you'll be giving them. Okay, so first let's start with clear liquids. So this short-term diet provides clear liquids that supply fluid and calories without residue. Okay, so it is often used with acute illness before and after surgery. This is a diet that consists of foods that are liquid at room temperature, that require minimal digestion, and leave little residue. Okay, so these are undigested material in the colon. So aside from this, clear liquids are easily tolerated by the GI tract and are often the foods recommended before some GI procedures such as GI examinations, x-rays, or surgery. Even after GI surgery or after fasting or intravenous feeding. Okay, so for those patients, okay, especially yung mga cancer, sorry, especially yung mga cancer patients or those patients who experience being totally dependent on parenteral therapy, like yung lahat ng nutrients nila dumadaan dun sa dextrose. Okay, so it could be because they are intubated sila or comatose or they cannot tolerate yung mga solid food kaya in-orderan sila ng um, IV fluids or total parenteral nutrition. Okay, so let's say na the doctor decided to let them shift back to normal diet but hindi pwede sila uh, mag full diet agad-agad. Why? Because their body is still going to adjust. Okay, so that is why mag-start sila slowly but surely. And your clear liquids is step 1 in this case. Okay, so permitted foods under your clear liquids. So these include clear or pulp-free fruit juices, clear carbonated beverages, clear meat and vegetable broths, the fruit-flavored gelatin, fruit ices made from clear juices, and coconut water. Okay, so take note of these permitted foods under clear liquids. Okay, so um, they may be colored, like say for example yung apple juice, but as long as they are clear, and allowed sila. Okay? Okay, so sample menu for your clear liquid diet. Okay, so for breakfast, strained orange juice, flavored gelatin, ginger ale, coffee or tea, and sugar. Okay, next for lunch, bouillon or consomme. Okay, so ito yung mga social na French soups. Okay, if as far as I know. Pwede din si flavored gelatin, frozen juice bars, apple or grape juice. Pwede din sila mag-take ng coffee or tea with sugar. Okay, pero yung nice din yung tea. Okay? Next, you have dinner. Again, bouillon or consomme, yung flavored gelatin, fruit ice, cranberry juice, coffee or tea with sugar. And then lastly, for snacks, pwede si soft drinks, fruit ices, and hard candy. Okay, so itong si hard candy, gisali siya kasi, di ba, nagme-melt siya. Okay, so it comes as solid at first, but once it's in the mouth of your patient, tapos na didissolve siya ng salivary enzymes, nagiging liquid siya. Okay, that is why included si hard candy dito. Okay, next we have general liquid. So this is a transition between clear liquid and a soft or regular diet. So this plan easily provides easily tolerated food. So examples, these include milk, strained and creamed soups. Okay, so mga soups na medyo malapot or mga creamy ang consistency. Grits, cream cereal, and fruit and vegetable juices. Ice cream, strained fruit juice, coffee, tea, and milk beverages. Okay, so that's for your general liquids. Okay, next we proceed to the soft diet. These are diets that contain foods that have been mechanically altered to modify texture or consistency. The foods may be liquid, pureed, ground, chopped, mixed, or tenderized. Okay, basta yung madali ma-chew ng patient or madali lang iswallow for the patient. Now, these are prescribed in cases of intestinal disorders and infection. Okay, so that's for your soft diet. Now we have foods included in mechanically altered diets or soft diets. So we have puree diet, so milk products like milk, smooth yogurt, pudding, custard. For fruits, we have pureed fruits and fruit juice without pulp, seed, skin, or chunks. We also have well-mashed fresh bananas and applesauce. For vegetables, we have pureed cooked vegetables without the seeds, skin, or chunks. Mashed potatoes, pureed potatoes with gravy. Now, as for meat and meat substitutes, we have pureed meat, smooth homogeneous soufflés, hummus or other pureed legume spreads. And for breads and cereals, smooth cooked cereals such as cream of wheat, slurried bread or pancakes, pureed rice, and pasta. Okay, so again, we have other examples. Okay, so again, for milk, yogurt with soft fruit, pudding, cottage cheese. For fruits, okay, still under soft diet, we have canned or cooked fruit without seeds or skin, fruit juice with small amounts of pulp, and ripe bananas. For vegetables, soft, well-cooked vegetables that are not rubbery or fibrous, they are well-cooked, also well-cooked moist potatoes. For meat and meat substitutes, you have ground, minced or tender meat, poultry or fish with gravy or sauce. We also have tofu, well-cooked moist legumes, scrambled or soft-cooked eggs. And for breads and cereals, we have cooked cereals or moistened dry cereals with minimal texture, soft bread or pancakes, well-cooked noodles or dumplings in sauce or gravy. Okay, so here in this picture, okay, so on the left we have a meal of pureed foods which can include meats, beans, bread, cereals, fruits, and vegetables that are pureed to a pudding-like consistency. Now, food should be homogeneous and cohesive. So, sticky foods such as melted cheese or peanut butter are generally not included. Okay. On the right, we have another example. Most foods can be ground or minced so that chewing is not required. The diet can include ground meats, soft, moist casseroles, scrambled eggs, and egg salad, bite-sized pasta, smooth cooked cereals, and mashed or minced fruits and vegetables. Okay, so please note the difference between pureed and ground. Okay, so kung pag ground, ano siya kanang very fine, fine particle. So may makikita pa rin ko yung mga mga pira-piraso. Okay? Pag pureed naman, quite soft. Okay? So talagang di na almost na liquefy pero mas thick yung consistency niya. Not exactly thick yung soft, soft siya but not sticky. Okay. Okay, so this one, another example. So this is a diet with soft textured, easy to swallow food, may include moist, shaved, tender meats, baked fish, cooked or cold cereals with milk, well-cooked vegetables, thinly sliced cucumber without skin or seeds, soft breads and cookies without nuts or seeds, and fruits without seeds or tough skins. Okay, so soft diet considered soft diet pa rin ito, but then mas maklaro yung mga pieces or yung mga slices niya. Excuse me. Okay, to continue. Okay, so next we have full diet or the regular diet. So this is the most frequent type of diet that you will hear in the hospital. It is a normal diet plan to provide the recommended daily allowances for the essential nutrients and to meet the caloric needs of a bedridden or an ambulatory patient whose general conditions does not require general modification dietary restrictions. Okay, so walang bawal dito. Okay, wala masyadong restrictions, wala masyadong bawal for this patient. Next, we have diet as tolerated. So this is indicated that gastrointestinal tract is tolerating food and is ready for advancement to the next stage. So this is given to the client's appetite. Okay, so that, di ba, marinig din nyo during endorsement. Next, we have low residue for your low-fat diet. This type of diet is try to limit fiber, a kind of carbohydrate found in some plant-derived food. So this diet limits intake around 10 grams of fiber daily and is designed to minimize the frequency and volume of residue in the intestinal tract. So pag low residue, you would want to limit the times na you would want to limit yung amount of residue or yung weight or yung content sa intestinal tract ni patient. Next, we have the low salt, low fat diet. So, sodium control diets are usually prescribed for patients with hypertension and for those with excess fluid accumulation. So, intake of commercially prepared foods such as cured or smoked meats, canned vegetables, and regular soups as well as buttermilk, salt and salty foods are limited or avoided. Okay, so white milk, fresh or frozen meats, unsalted vegetables and fruits, and low sodium foods, however, are included. Now, for low fat, this diet is often prescribed for patients with GI disorders or excessive body weight. So, it limits the intake of fatty foods such as margarine, mayonnaise, dressings, oils, and gravies. So, the diet usually includes whole wheat breads, lean cuts of meat, skim milk, low fat cheese products, eggs, vegetables, and other food items prepared without extra fat. Okay, next, we also have the diabetic diet. The diabetic diet varies from patient to patient depending on the type and intensity of the diabetes, okay, the patient's personal history, and individual nutrient needs. The exchange list for meal planning established the serving size amount for carbohydrates per meal based on calorie recommendations. Meals are basically like those found on a regular menu, but carbohydrate servings are carefully controlled and small snacks may be included in the meal plan. Now, carbohydrates are starches, starchy vegetables, juice, fruit, milk, and sugars. Okay, that's for your diabetic diet. Okay, next one, we have the renal diet. So a renal diet is carefully planned with special consideration of the nutrients, and it is often adjusted as kidney disease progresses. So a renal diet may serve the purpose of attempting to slow down the process of renal dysfunction. So if dialysis treatments are not being taken, the doctor may restrict protein intake of foods such as potatoes, tomatoes, oranges, and bananas. Okay, a phosphorus restriction may also limit the intake of milk and dairy products, dried beans and peas, while grain breads, cereals, coffee, tea, and dark-colored soda beverages. Okay, so take note of the restrictions under renal diet. Next, we have infographics or graph with regards to selecting the feeding route. Okay, so if the patient, you have to assess whether or not the patient has adequate nutrition status. If yes, pwede siya mag-oral diet or regular diet. Okay, so reassess nutrition status regularly. The patient may also have simple IV to maintain hydration if necessary. So if the status changes, you have to check whether or not nag-function ang GI tract niya. So if yes, the appetite is the appetite satisfactory and physically able to eat? Okay, so if yes, oral diet pa rin, but you give supplementations as necessary. Okay, so pag no naman, enteral nutrition via feeding tube will be done. So dito magpasok si nasogastric tube or your NGT. Okay, so on the other hand, pag hindi maganda yung nutrition status ni patient, that's the time that they will be ordered to be on nutrition support. Okay, and the doctor will decide for an appropriate feeding route. They will also factor in or weigh on the state of the GI tract. Okay, so let's say hindi maganda yung GI tract niya, hindi functional, then only short-term support, anticipation, and not severely malnourished. Okay, so they have to consider yung nutritional status ni patient. If severely malnourished, then they will give parenteral nutrition by peripheral vein. Okay? If not, um, if the patient is um, if is not severely malnourished, then they will give nutrition by central vein. So ito siya, the difference between your peripheral vein and central vein. Itong si central vein, okay, so these are used uh, for solutions or IV fluids that are quite heavy. Okay? Kasi hindi sila pwede sa peripheral veins because as the blood vessels branch out to the extremities, like those in the arms and legs, mas manipis yung mga veins on the blood vessels on the periphery. And they cannot tolerate yung mga large volume IV fluids. That is why yung mga large volume IV fluids ideally nasa central vein sila nakakabit. Okay? So I'll be showing you a video, okay, about parenteral nutrition, okay, and anong itsura ng patient na may central line and as compared to peripheral line. Itong si peripheral line, for sure, nakikita na kayo ng patient during your pre-clean na may mga IV fluids doon sa mga kamay nila or sa mga vessels in their hands. Okay, so those are examples of peripheral veins. Okay, pag central vein, these are blood vessels or these are IV routes that are closer to the heart of the patient. Okay, so hindi siya magdaan ng shortcut na siya or diretso na sa circulation. ipag central vein. Okay, so before I show you some videos on parenteral nutrition, let's go into enteral nutrition, okay, or feeding with the use of a tube, okay, or feeding tube. Okay, so we have the following candidates for tube feeding. So for those patients who have severe swallowing disorders, impaired motility in the upper GI tract, GI obstructions and fistulas that can be bypassed with a feeding tube, those patients with certain types of intestinal surgeries. We also have little or no appetite for extended periods, especially if the patient is malnourished. Okay? Extremely high nutrient requirements. We also have, this is also given to patients on mechanical ventilation. Okay? So these are patients who are comatose, okay, and they are uh, totally dependent on a machine to help them breathe. Okay, so unconscious sila. You cannot, definitely, hindi sila pwede mag regular oral feeding. That is why meron silang feeding tube. Okay? They may also have patients who are ordered to be on tube feedings. It's also because they may have mental incapacitation due to confusion, neurological disorders, or coma. Okay, I mentioned that one. Okay, so for those who are in a coma but not dependent on mechanical ventilation, okay, so may spontaneous breathing pa sila, they may be they can be candidates for tube feeding. Okay? Okay, so contraindications of tube feeding. So if the patient is experiencing severe bleeding, okay, so may mga instances kami noon na may patients kami, mga ICU patients with an NGT, but then pag drain namin or rather pag aspirate namin ng gastric content, may coffee ground na output. Pag coffee ground, meaning yung may pagka-dark siya na gastric output, think yung ano, yung uh, ground na coffee or yung brewed na coffee, di ba black siya? Okay, so coffee ground colored out gastric output is an indication, would indicate severe bleeding. Okay, so no sa kanila na bigyan sila ng food. Kasi all the more na ma-injure yung stomach nila. Next, you're also not supposed to give tube feedings to patients with distended abdomen. Okay? Also, those patients who are suffering from vomiting or diarrhea, sayang lang yung food kasi i-expel pa rin nila. Okay? Or the vomiting or diarrhea is a reflex, okay? Especially for those patients who are suffering from irritable irritable GI tracts. Okay, so instead of giving them tube feedings and oral feedings, binibigyan sila ng parenteral nutrition. Okay, so ito one example. Definitely you already went through your MCN. Okay, so there's this condition known as hyperemesis gravidarum. Okay, so this is abnormal vomiting in the pregnant woman in the second trimester and onward. So the problem with your hyperemesis gravidarum is most patients cannot tolerate food and even drink. So if bigyan mo sila ng food kahit konti, matitrigger yung kanilang vomiting reflex. So that is why they are totally dependent on IV fluids or TPN, total parenteral nutrition. Okay, so here I just want you to be familiarized with the different tube feeding routes. Okay, so yung pinaka-common si nasogastric placement. There's also nasoduodenal placement. Okay, so dito siya, itong red na part. They also have nasojejunal placement. So sa jejunum mag-end yung ano, tubing. Okay? Next, we have shortcut routes, the tube. So we have gastrostomy. So the feeding tube is already directly in the patient's stomach. Okay. Another one is your jejunostomy. Okay, so the feeding tube or the feeding opening is here in the jejunum. So just to zoom in na lang. Okay, I'll just try to, I'll just open some videos for you to watch, okay, for you to appreciate yung differences between the different tube feeding routes. Okay, so here's this one picture. We only have one picture for gastrostomy. So yung feeding tube is placed directly on the stomach of the patient. Okay, this is an opening into the stomach through which a feeding tube can be passed. This is created using local anesthesia. Yung isa, enterostomy. So this is an opening into the GI tract through the abdominal wall. Okay? Okay, next we have parenteral nutrition. So parenteral nutrition is typically recommended for patients who are unable to digest or absorb nutrients. Okay, so na-mention ko, yung hyperemesis gravidarum, that's one example. So candidates for parenteral nutrition, so those who are experiencing intractable vomiting or diarrhea or continuous, okay, severe GI bleeding, intestinal obstructions or fistulas, paralytic ileus, or intestinal paralysis. So kahit bigyan mo sila ng food, there is an inability of the patient's GI tract to push through with the normal process of digestion and absorption. Okay. Next, you also have short bowel syndrome. So a substantial portion of the small intestine has been removed. So hindi sila pwede sa tube feeding, but pwede sila sa parenteral. Next, severe malnutrition and intolerance to enteral nutrition. Okay, so hindi talaga nila ma-tolerate yung mga oral or not regular feedings. Okay, so we have venous access. Okay, so peripheral parenteral nutrition or PPN, these are nutrients that are delivered using only the peripheral veins. So yung mga patients na nakikita ninyo sa pre-clean, yung mga dextrose nila or IV fluids rather, they are mostly on the veins of their hands. Those are our peripheral veins. However, pag total parenteral nutrition or TPN, most patients meet their nutrient needs using larger central veins, where blood volume is greater and nutrient concentrations do not need to be limited. So if you want to give large volume fluids to your patient, central line is the way to go. Okay, so this method can reliably provide all the person's nutrient requirements. Because the central veins carry a large amount of blood, parenteral solutions are rapidly diluted. Thus, patients with high nutrient needs or fluid restrictions can receive the nutrient-dense solutions they require. And one example of your TPN is Cabiven. Okay, so I've seen and handled this before. Okay, so medyo mahal ni siya. It can go as high as 1,700 plus or 2,000 plus yung ganito. Okay, so no siya na ma-break kay ma-charge sa'yo. Okay, so it's fun siya i-prepare if you do not consider the price, no? Malingaw kayo mag-pop doon sa compartments niya. Okay, so this is a very interesting IV fluid. Okay, so the components of your Cabiven, so we have mga liquids, may protein na part, may fat na part, may milky na part. So when you prepare this, you have to push or press or rather press on these compartments para ma-open itong sticky na parts. Okay, so once you press each of the compartments, this will allow for mixing of the different components of your Cabiven. And then you're going to treat it like an IV infusion. Okay? But instead of peripheral vein, sa central line ito siya dapat. Okay? So at this point, I'm going to prepare a set of videos for you to watch. Okay? Para mas ma-appreciate ninyo yung lesson. Okay? So I'm going to stop recording and I'll just prepare muna yung videos that I would want you to watch.